How do you know if your loved one's wound is infected? I'm Bienstock, and I am a board-certified plastic and reconstructive surgeon. My expertise and my specialty is wound care in the home, and I take care of people in their houses. So it's not uncommon that I receive a phone call from a patient or a loved one concerned that there's a wound infection. How do you know if it's infected? This is generally a really tough answer to give you because it's a clinical decision. If the wound smells or has what we call cellulitis or redness, these are signs of infection. If it's become worse, these are obvious signs. The bigger question is, what do you do and who do you call? So the first thing is to call your primary care physician, or if there's a nurse involved, to get their perspective. What's excellent in 2025 in modern times, we can use photographs as well as video to assess things. Maybe AI will replace these things in the future in terms of assessing whether wound's infected. But right now, it's a clinical decision. So we can use visualizations via photo or videos. If your primary care physician can't come to the house, maybe you can find someone that can. Hopefully you have a nurse that's involved if there is a wound, and you can ask them or one of their colleagues to come as quickly as possible. This is not something you're going to be able to make a decision on your own. It involves the whole caregiver team. Sometimes I get called on wounds. People think it's infected. It's just the skin is a little bit irritated and red, or there's a fungal rash, which is due to heavy moisture. And these are things that can be prevented with fungal creams or fungal powders. Even primary care physicians will miss wound infection. They'll think something is infected when it's not, or they'll think a wound is not infected because they see a black eschar, which means it's a black scab, and underneath can be pus, which you can't appreciate until you open it up or you appreciate it by touch. So, in summary, analyzing what is and what is not a wound infection is a clinical decision. This usually has to be done in the home by a healthcare provider, whether it be a nurse, primary care physician, or a specialist. It's very difficult usually to assess via photos or videos, but they can help and assist you. But if there's really concern, you have to have this checked out sooner rather than later before starting antibiotics or requiring what's called a surgical debridement. If you have any questions, please feel free to reach out. And when you get a chance, please subscribe.